Hello. Welcome to a second in the series, Cracking the Code. I'm Dr. Julie Pennick, one of the faculty here in the online nursing department. Last week, Cracking the Code focused on CPT evaluation and management codes. This week, there's the provision of an introduction to the ICD-10 coding system. What is an ICD-10 code, and why do you need it? It's the International Statistical Classification of Diseases and Related Health Problems. Work on the ICD-10 version of the code, there were prior versions, started in 1983, and around the globe early adopters started utilizing the ICD-10 system as early as 1994. In the United States, we have adaptations of the ICD-10 system that we use. We have the ICD-10-CM, which stands for Clinical Modification. That's a coding system that deals with the diagnostic categories and symptom categories. And we use the ICD-10 PCS, which stands for Procedure Coding System. And this is the system that has all of the codes for the different tests that you order, imaging studies, things of that nature. The focus of today's presentation will be on the ICD-10-CM. Here in the United States, around October 2013, after several other prior adoption dates had been pushed back. So October 2013 is fairly well when we consider the ICD-10 system was started in the United States with a deadline of full implementation by 2015. So in that transition period, providers and agencies and organizations were transitioning away from the ICD-9 codes to the ICD-10. Why do you need it? If you're going to want to be reimbursed, any of your billing processes are going to need to include your ICD-10 codes. When ordering diagnostic tests, imaging studies, blood tests, anything of that nature, certain prescriptions you're going to want to include the ICD-10 code on. When ordering durable medical equipment, and when completing referrals to other providers of healthcare, whether that's other in-office healthcare providers like specialists or physical therapists or occupational therapists or other healthcare agencies like home health and things of that nature. So in this cartoon, apparently a farmer has come into the provider's office with what appears to be a goat's horn impaled into one of their body parts. We don't know what happened between the farmer and the goat before they got here, but now the farmer has arrived in your office. And the receptionist says, "I'm sorry, Mr. Johnson, I've checked everything. Your insurance company won't cover your visit because there's not an ICD-10 code for this." Well, there's probably not the level of specificity for an ICD-10 code for impalement of horn from angry goat. But there are certainly ICD-10 codes that would be appropriate for the provider to assign to this encounter, traumatic injury, pain, or just a couple that I can think of off the top of my head. The ICD-10 coding system begins with a base character. They relate to chapters, if you will, in the code. And then as you get more specific information and you want to code to a higher level of specificity, there are add-on characters. So here's an example of that. Type 2 diabetes mellitus, the first three codes are E11. When greater specificity is learned through your evaluation of the patient, you can add on modifier codes or additional strings of characters to allow for higher level of specificity to be known. So in the case of type 2 diabetes mellitus with proliferative diabetic retinopathy without macular edema, you would code it as E11.359. If you don't have the ability, you don't have all of the information that you need at the end of the encounter with the patient, you don't have a definitive diagnosis, you can code based on the symptoms. So the patient comes in and they're tired. So you're going to do a workup, but you don't have the results of that workup back at the end of your visit with the patient that day. You can code it for the symptom. So other malaise and fatigue is R53.8. all of your tests come back and oh, lo and behold, the patient has iron deficiency anemia. That's why they're tired all the time. You can then code the condition with D50.8 because that's the code for iron deficiency anemia. And I've included a link at the bottom of this slide where you can search the ICD-10 coding system free of charge. In this cartoon, you see the gentleman is having coffee with his colleagues. And he says, oh, my doctor gave me a clean bill of health. And one of his colleagues says, well, I guess that's all that good food and exercise. And the gentleman across from him says, either that or they put the squeeze in him for questionable billings. Now, is he saying that the doctor has a problem with billing, or are they saying that the gentleman's not really in good health, or they don't think he's in a state of clean bill of health? Who knows? But I utilize this cartoon to point out this piece of information for you. Yes, the codes are used for all of the things we discussed in a previous slide. The coding system also allows for large data sets to be extrapolated from large electronic health system data files. And this is how they know that 25% of all specialists code at a 99215 level, but only 12% of primary care providers. And that's not real statistics, but they will be able to compare coding patterns between specialty groups and primary care groups, or one provider group to another provider group. A lot of people have the ability to gain data access through the standardized classification system. And researchers have the ability to pull large data sets and compare outcomes from different therapeutic approaches. So the system is utilized by the provider for one thing, but the ICD-10 system can be utilized by third-party payers, governmental agencies, groups of researchers to be able to gain access to large volumes of data. So a recap, the ICD-10 coding system allows you to determine the illness, diagnosis, injury, or code symptoms to the highest specificity possible for each encounter that you have with your patient. It allows other organizations, governmental organizations, and researchers to extrapolate data around specific diagnostic categories for evaluation of provider activity, cost efficiency of care, and best outcomes based on therapeutic modalities. Coming to a healthcare environment near you in January of 2022, ICD-11. Well, not here in the United States. The targeted adoption date for the ICD-11 in the United States is 2025. What is the value as the ICD code systems progress? Greater levels of specificity, allowing for greater clarity of communication between providers, and the ability for researchers to gain access to data sets for highly specific conditions. On this slide are some of the websites that I utilized when gaining knowledge to prepare this presentation for you. Thank you.